Hello, everybody. Good morning, good afternoon. Welcome to another session of TMF Week on our final day. Sad face. We've got three more sessions for you today. And the next session that we're going to be tackling is to tell a better TMF story using integrated systems for a more holistic approach. So lots of really great content to tackle. While I am going through my slides, I would love to hear from, again, as usual, where are you guys coming in from? Let us know where you're viewing this presentation from today, and if you're enjoying TMF Week, if you've enjoyed it so far. Again, just some housekeeping rules for those of you that have been involved in a couple TMF Week sessions. You would have heard this already, but feel free to use the Q&A box to submit your questions. There is, next to this little chat, there is a little question mark Q&A box where you can ask questions to the audience, and we will be tackling those in the session. So please make sure that you ask those questions as we go through. All of the sessions, of course, will be recorded, so you'll be able to get access to those presentations after the event. Every single attendee of TMF Week will receive a certificate of attendance. You can add that to your LinkedIn profile, to your training record, whatever you want. After each session, there are networking breaks, and these networking breaks are being held in the lounge. So if you go back to the TMF Week dashboard, so navigate out of the agenda, you'll be able to head over to the lounge. There's a number of different tables in that lounge that you can speak to. So without further ado, I'm going to introduce today's guest speakers, both colleagues of mine at Montreal. Paul Fenton, President CEO of Montreal. Paul, of course, has significant industry experience at the senior management level in the development, deployment, and management of computerized systems for use in regulated clinical trials. Of course, Paul is the CEO of Montreal and founded the organization in 2005. Has a strong background in CDISC and ICH standards, as well as the integration of systems and processes for clinical trials. So, of course, important for today's session. Paul is, of course, also the co-chair, of the eTMF exchange mechanism standard and part of the TMF reference model steering committee. And you can caught Paul's presentation yesterday on standardization in the industry. You would have heard all about the exchange mechanism standard and the reference model in that session. Paul today is joined by Catherine Cinciarelli. Catherine is an eTMF product owner at Montreal and works within Montreal's product team. As a product owner, Catherine ensures that the Connect platform that Montreal provides is aligned with life science customers' needs and requirements. Catherine is an engineer by trade, and she's a key member of Montreal's team and plays an active role in disseminating product feedback to the development team to build better products for our customers. Catherine is focused on optimizing clinical trials surrounding the changing regulatory landscape, IT transformation in life sciences, and of course, process optimization. So with that, I'm going to add these wonderful people to the stream. Hello, wonderful people.
Hi, everybody.
And I'm going to
everyone.
Stop sharing my screen. Catherine, you're able to now start sharing. And again, as Catherine is doing that, let's just another reminder. If you have questions as you go through this process as this presentation, and you want to ask questions to Paul or Catherine, throw them into the Q&A, or if you can't find the Q&A, throw them into the chat. So with that, I will take myself off, and I'll hand it over to both you and Paul. Catherine.
Wonderful. Thank you, Oliver. Hi, everyone. It's nice to see so many people online. I'm really excited for today's presentation. So like Oliver said, we'll be talking today about how we can tell a better TMF story. And it's really focused on using all of our different systems and integrating them to take a bit of a more holistic approach. So as we're all very aware, I think we know that the clinical trial landscape has fundamentally changed. We've had new players, rapid advancements in technology, regulatory guidances that have been put forth, and of course, COVID-19, that have added all of these different complexities to our trials. And with that has added different additional challenges to the space in itself, I think. And so if we sort of look, and I'm just setting the scene here, but if we're looking at just the landscape as it is today in terms of stakeholders, we have many different stakeholders that sort of revolve around the sponsor. So you have your CROs, your sites, your partners, many vendors. And all of these different stakeholders are storing or hold information that's pertinent to the trial. And that information is stored through documents and data. And where are those documents and data stored? They're all stored in systems. And so each and every one of those stakeholders holds a system. And this is, I think, what the eTMF landscape looks like today, or at least, a version of it. So we have TMF content that is found obviously in the eTMF, but there's also inspectable TMF content scattered a little bit around every one of these systems, right? And so while these systems might have TMF content, they're not always with the same stakeholder, the same people, or in the same system at all. And so it makes for really challenging inspections. It also becomes, I want to even say a little bit disjointed or decentralized because your information is stored in all of these different places. And of course, that would lead to challenges with oversight. And so I think we need to be asking ourselves at this point, with these increasing challenges and with the increase of information and decentralization, how can we start telling a better story? We need to be able to visualize our documents and our data in a more holistic manner based off of events and processes, and not just as it is today, which is, sort of static classifications. We have all of these disconnected systems, and we really need to be, one, integrating them to tell a better story. Two, clustering our documents by processes. And three, trying to embed the quality into our processes, right? So let's just go ahead and get into it. And as Oliver mentioned, if anyone has questions, I know that both Paul and Oliver are going to be fielding them. And so if you do have any questions while we go through this, please feel free. We'll make this as interactive as possible. So let's start with integrated systems for a more holistic approach. So as we briefly discussed, we have many electronic systems that are now used in the clinical trial conduct. These systems all hold inspectable records and documents, right? We either need to have links to these documents from the eTMF, or we need to have copies of these records stored in the eTMF. And that's obviously not very practical, right? We don't want to duplicate our work. So we need to start looking at how we can integrate all of these different systems that hold these inspectable records and data, but not just integrating them, but also trying to find a way to show the relationships between these different systems, between the different datas. So we need to integrate them, have them all in one centralized location, but without losing the relationship between all of this different data and the different information. So all that to say, I think we need better integration, right? We looked at that eTMF landscape, or a version of it today, where we had all of these bubbles or systems sitting in isolation that didn't really connect with each other. But in this case, we have the sponsor's eTMF, which sits sort of in the middle of everything, and all of the other systems are rotating around it. And there's a constant flow of information that's either being pushed and pulled from the sponsor eTMF and to your CTMS or your regulatory information system or your data capture system, right? So it's all these systems that are now speaking with one another. So I'd like to take a bit of a deeper look into the actual systems and how we've actually classified them. So again, we have all of these different systems that are TMF relevant, but we've really categorized them into our clinical data systems and our operational data systems. Now, your clinical data systems are simply repositories, right? They're holding information that is pertinent, or they're holding data that is pertinent to your trial. So examples of these systems are, your imaging systems, your EDCs, your pharmacovigilance. And then on the flip side, you have sort of your operational data systems, your clinical operational data. And I think these are, the systems that hold evidence of your daily activity, and they're actually going to be driving processes. And so most of your study conduct is actually stored within your operational data systems, right? So I'd like to dive a little bit deeper into 3 of these operational data systems. So your quality system, or your QMS, your eTMF, or your electronic trial master file, and your CTMS. Now, these 3 systems, and I think I'll be focusing primarily on these today, are extremely intertwined, right? So you have your clinical trial management system, or your CTMS, which is really your reporting system. Then you have your eTMF, which is, information management. It's putting data and information into context. And then you have, sort of sitting at the top, your QMS, or your quality system. And this is really where you're going to be managing the processes that exist in your study. So what are your relationships between the processes? What are your inputs and what are your outputs? Okay, so that's really what the QMS does. The processes would be defined in your QMS, of course. So, what needs to happen and what are the deliverables that need to be produced. But there should also be like an electronic database of processes with information that may be relevant for, say, your TMF to generate placeholders, for example. You can fill those placeholders in your TMF. So that's, your TMF holds that content. So you would fill placeholders in there. But because it's being triggered from a process from your quality system, all of a sudden you're now clustering your documents around processes. And we'll talk a lot more about that later, so I won't get into it too much. But once you have those documents in your eTMF, all of that data-rich content can actually be pushed into your CTMS. And your CTMS as a reporting system can trigger red flags for anomalies or deviations, and actually feed that back into your quality system. So I know that might seem a little abstract, or maybe it's not super representative of what's on screen, but I think you can see that there is a very cyclical relationship. There's information being pushed and pulled from all of these systems, and there's a lot of retroaction. So just to sort of make it a little bit more concrete, I'd like to go over 3 hard examples of this. Okay. So these are examples of integrations between these 3 systems, of course. So if we look at number 1, we have in your CTMS a site that's been added. Through an integration with an API in your eTMF, you would then pull that site into your eTMF, and you would actually trigger 3 placeholders in this case. So we have a feasibility report, a debarment statement, and acceptance of investigator brochure. So it's a pretty simple interaction between your CTMS and your eTMF. Now let's look at the second example. So in here you've defined an SOP on site visits. In your monitoring plan, you've defined that 2 criteria, right? Visits need to happen at the most every 5 months, and your monitoring visit report approvals need to be approved within 15 days, right? That document is then uploaded into your eTMF, your monitoring visit report, and your CTMS has detected that that approval date that you associated to that monitoring visit report is actually past that 15-day criteria as defined in your plan, right? There is an anomaly detected, a red flag, and so a deviation is actually created into your quality system. And so this is a really prime example of an integration between all 3 of those systems, and how integrating processes and integrating your systems can really help with that process. And finally, we have a study member that's been added, right? This will trigger a training in your quality system, and the output of that training would be a training certificate, which would be stored as the inspectable record in your eTMF. Okay. So I'm going to hand the reins over to Paul to talk a little bit more about those processes that we touched a little bit on.
Great, thanks, Kat. So I think the future is all about having a process-based TMF rather than a functional TMF, which is what we have today. And I really like the ideas that Kat was talking about in relation to the interconnectivity of those three systems and the fact that they drive each other. So I'm gonna deep dive now into what I call process-based TMF and predictive completeness. The next slide. So obviously, I think the vast majority of us today organize content based on the reference model. And as we know, the reference model is, it's 11 process zones, and those process zones typically are very sort of functional in nature. So you have, your regulatory zone, your data management zone, your statistics zone, your site management zone. These are all sort of really sort of based on functional areas and based on sort of historical ways of gathering and creating content for the TMF. The problem is that it's actually quite difficult to reconstruct events that have occurred in the study using that structure, because ultimately, we need information that's coming quite often from multiple different places within those 11 process zones to really understand what happened in the study. And obviously the goal of the trial master file is to tell the story of the study. Inspectors spend a lot of time doing this, just trying to find all of the different artifacts to truly understand, well, what happened. So I think that there's a different approach which we should be looking at, which I think would give us much better results and actually make it easier, not only for inspectors to understand, but also the operational teams. And so, by having a clinical process model at the heart of our TMF, or even at the heart of that trio of systems that Kat was talking about, will make it a lot easier. And we'll also be able to sort of provide better visualizations of specific instances of processes. The other thing that's important is clustering. So if we think about clustering information around particular events or particular processes that have occurred in the study, that's really the groundwork that the inspector does. And so if we can do that in a more automated fashion, and start out by actually organizing our TMF that way, I think it will serve us well. Now, the processes that Kat was talking about, so these are sort of standard clinical processes that we typically manage within a clinical trial, would be triggered by events. There's a lot of different events that can occur in a study, and typically those events will trigger processes. And I think that this approach really would allow us to tell a better story. So let's move to the next slide. So this is an example of what I'm talking about. So at the top of the screen, you can see that there's a protocol amendment. So we've amended the protocol. This is an event in the study, and this event is going to trigger a whole bunch of other processes that need to occur. So we may have to revise our ECRF. We may have changed, say, inclusion criteria or something like that, which requires us to capture different data. We may need to change our SAP. We may need to revise that. And then when we revise that, we would maybe also need to revise our statistical programming. We would need to get IRB approvals for all of for the protocol amendment for all of the various different countries and sites if they're local IRBs. We need to collect signature pages from all of the different investigators, and we also, of course, need to get regulatory approval. And so, if you look at this one event, this one thing that happened in the study, it's actually triggering a whole bunch of other processes, and it's also potentially creating placeholders for maybe hundreds of different artifacts that we need to ensure are present in the TMF. We also, by taking this approach, can think about, well, the cluster. This can be a cluster of documents that are all related to the protocol amendment, and so that, I think, is a huge benefit when reviewing a TMF for a study. Next slide. Now, at Montreal, we've been working on a concept called predictive completeness for a little while, and also working on this idea of process modeling. As we know today, completeness is really a very big challenge in the industry. We have a lot of systems that give us a nice sort of percentage, 75% complete, but in reality, it's not accurate. And it's not accurate because to be able to accurately calculate completeness, you need information. And the information that we have today is usually input manually in the form of document counts, expected document counts, by either a central TMF group or the study teams. And we sort of rely on the study teams to provide the information that would tell us that we should have certain artifacts. So it's not ideal, it's very manual, very labor intensive as well. And so by taking a more sort of process-based approach where we can actually integrate a process model into the system, as well as integrating all of the other systems that have data that could trigger events in the study. So for example, connecting to an EDC so that when there's an SAE that's registered, we know about it and we know that we're then going to have to kick off, say, a safety case process. So getting those two things in place, I think, is key to enabling this approach. And the generation of placeholders automatically based on our process model, I think, is huge. And we can also think about different study designs that would typically have different processes. So for example, if you have a non-randomized study, well, obviously we wouldn't have expectations around management of the randomization list. So you can really sort of think about various different study designs as well that you could integrate into this. And placeholders today, we typically generate placeholders just for documents, but in the future, if we have this process-based approach, we can also create placeholders for events and processes and even things like milestones, based on the model. And I think finally, obviously, we're all now starting to look at artificial intelligence and machine learning. I think that there's also a really interesting use case here to be able to leverage that technology. Next slide.
Yeah. Before we continue, Paul, I'm curious to know if, it seems to me like clustering of documents it just gives you the ability to visualize a process so much more easily. Have we seen any evidence of this in any of the regulatory agencies? Have there been guidances or any hints that are looking a little bit forward at this process space?
So obviously there are some new guidances that came out recently in the last couple of years, notably from the EMA, but there's no specific call out as far as I'm aware around clustering. They haven't said you have to cluster documents and provide us access to that. What they do say is that you have to provide direct access to all of your TMF, and obviously with remote inspections that can become quite challenging for inspectors to be able to find the information that they need. I have sort of participated in quite a few inspections in the past and also attended some of the MHRA symposium. And they were actually quite vocal there about clustering and taking us through the process that they currently have to do manually, and then talking about how neat it would be if the system could do this for them. And I think that those experiences really is what sort of spurred us to start to look at this at Montreal. So thanks for the question, Lokat. Good question. So just to try and visualize what this all looks like. So this is something that we're sort of working on right now, and we've mocked up where we have this visualization of a particular process. So you can see here that this is a process which relates to a protocol amendment, so version 0.1. Which will replace version 0 of the protocol. And this protocol amendment was triggered by an interim analysis that occurred in the study, which required us to make some changes to the protocol. It could be related to sort of the safety profile, or maybe also to do with sort of inclusion or recruitment. And so this protocol amendment process has also triggered a series of other processes. So we have regulatory approval, modification to SAP, ethics approvals, and then the site protocol signature pages. And the color coding also gives us an idea of where we're at in the process. Ideally, everything should be green. It means that we have all of the placeholders filled, all of the artifacts are final, they've been reviewed. We're good to go. Anything that's red means that we're still missing stuff. And so you can apply completeness directly into this visualization. And then below, we can also see the cluster. So these are all of the different records or artifacts that relate to this particular process or the associated sub-process. We also, on the other side of the screen, can see this timeline. So this timeline is also being generated again by this process model, and this can be generated automatically, and it can be generated based on information that's coming from other systems. So, for example, we could see in the conduct section, 25% recruitment achieved. That's typically something that's coming from, say, EDC or maybe from CTMS. So this is really the kind of visualization that we want to be able to provide. And then we also want to be able to provide the ability to navigate through this, making all of these sub-processes clickable so you can really sort of drill in and understand what's going on. Next slide. So how do we achieve this? It sounds great, right? I'm sure all of you are thinking, okay, I need that now. But I think we've still got a little ways to go. It's actually quite complex. If we think about all of the different processes in a clinical trial, there are a lot of them. I know that we already did an exercise to try and map out all of these processes and events. I think we came up with a set of around 350 different processes that could exist at different stages during the study. And I think that there's actually a real opportunity here maybe for the industry to start to develop a standard process model. You know, and maybe it could be associated to the TMF reference model. That would kind of be the obvious home for it. And this model would allow us to define standard processes and events. Maybe all of the triggers for those processes. So what triggers a particular process, and what are the relationships between those processes? And then finally, we could even think about defining artifact clusters and metadata that we typically would require to be able to describe these processes and events. So I think that's something that we should sort of keep on our radar, and I'm sure that there'd probably be quite a few people that would be interested in participating in developing such a standard or model. The other area that's important is obviously interchange standards. And so there are existing standards, things like CDISC that have standards for clinical data, but also the EMS that we've developed as part of the reference model. Next slide. And then the other thing that I think is important is that we should maybe think about leveraging artificial intelligence, but also human intelligence. And I'm a great proponent of artificial intelligence, but I think it's also important that humans are involved and integrated into that process. And so I think that we could have obviously templates for different study designs, and then we could use AI and machine learning to be able to extract context and metadata from all of the different artifacts that we have. And some prime candidates here could be things like emails. We have a lot of emails in our TMF. They get filed under correspondence, but it's kind of difficult to find the information unless we do sort of full text searching. If we leveraged AI and ML, we can actually analyze those emails and identify the context. So, it's a waiver for this subject at this site for this particular reason, and then connect those identified artifacts to other artifacts or other processes or even just the site itself to make it easier to pull everything together. I think we also need to have active management of the process instances, so the placeholders that we're generating. And this is really where I think that, all of the TMF teams that manage TMF today, their job will be transformed in the future. They'll actually be much more active in managing the data, managing the processes within the system, and removing or adding artifacts or processes where necessary. And this human interaction is really important if we're also using machine learning and AI to actually improve our process model and improve the algorithms that we use to be able to predict what we should actually have in our TMF. So it's kind of it's cyclical, where humans are giving input and then the machine is learning from that. And I think if we can get to this place, the TMF will be transformed, and it will no longer be just a repository of documents. It will actually be a really important process management system that we use in clinical trials. And with that, I'm going to hand it back to Kat, who's going to talk about quality.
Thanks, Paul. No, I completely agree with you. I think, you know, with this predictive completeness, with the clustering of documents, and, you know, I'm going to talk about quality in a second, but I think if we're looking at the TMF in this way, if we're implementing, you know, even machine learning algorithms, I think inherently our quality will increase, right? Just by implementing these types of standards. Okay. And so that's what I'm going to cover in the next section. It's essentially quality embedded in design, right? Quality by design. It's about building quality gates into your processes, right? And we all know quality gates and quality checks. But I think at its core, it's really about integrating it into your processes at a higher level. And of course, this can be done with checks and gates. But if you have a quality system, and we sort of saw that in, you know, that mock that Paul showed, that defined your processes electronically, then you can really drive your clinical process workflows from that. Much like you would drive a document through tasks, you can drive a clinical workflow in the same manner, right? So I just want to go over another example here of how we can sort of integrate that quality into our process. And we can see here we have an ethics committee approval process that has actually been triggered from a protocol amendment. Now, we have the process, which is the ethics committee approval process, that is linked to a series of sub-processes, right? Preparation of packages, preparation of the submission letter, the submission itself, and then of course the response, whether that be the submission approval or rejection. And so we've actually defined these sub-processes linked to that higher level process. And so that should really drive our workflow going forward. And so that might, again, trigger hard data, hard artifacts as placeholders in, you know, your information management system. And so we might need an advertisement for subject recruitment, or we will need an advertisement for subject recruitment and the actual protocol amendment. And then for the submission, the sub-process for submission, we would need an ethics committee composition, right? 04, 01, 03, a request for additional information, and the ethics committee submission 04, 01, 02. But more importantly, all of these different processes, sub-processes, and artifacts are linked to people, to roles. And so we're really pushing this workflow forward at every level, at the document level, but also at the process level. And I think that's when we're going to start to see, you know, an increase in that quality, right? Because we're looking at the TMF as a whole. And so that's sort of what I want to talk about next, taking a data-driven approach to improve your quality metrics. So I think today we're really focused on the quality of the individual documents. You know, does it meet Alcoa? And of course, the quality of these documents are extremely important, but we also need to make sure that the TMF makes sense as a whole. So it should be logical in its content. And so to be able to do that, we need to look at documents, of course, but also look at the data associated to these documents, right? So by applying data management type techniques, similar to what we see in your electronic data capture, we can run these logical checks on the metadata stored in our eTMF to make sure that it's really telling the accurate story. Okay. So I think by doing this, we'll be able to gain a degree of confidence in the quality of our TMF, in addition to what we already have, which is the quality of the artifacts themselves, right? So let's take a look at some examples of these edit checks that we spoke of. So we have, you know, an incorrect event sequence. So if your statistical analysis plan approval date comes after the database lock date, there's clearly an issue there, and you might be introducing bias into your study. And so even if the SAP was approved because it, you know, was of quality, the metadata there is telling us a different story, and it's telling us that, you know, there is an incorrect event sequence there. Or, for example, a missing version. So if we have events for version 1 and 3 of a protocol, but there's a gap and we don't have it for 2, something should be triggered there. Now, I think there's a differentiation that we can make here between anomalies and queries. So they're very similar, right? An anomaly and a query is something, a red flag in the system in both cases. But I think we have anomalies which are taken from rules that we have told the system. So we've told the system that if the SAP approval date is greater than the database lock date, it should trigger a red flag. And so if we have our system working for us, there's a lot less work, or at least we're going to catch a lot more things. And then, of course, we also have queries, which very similarly are manual. So it requires human intervention, but during your TMF audits, you can also raise those red flags and then close those queries either through note to files or justifications, right? So the next thing I want to talk about when we talk about quality is obviously taking a risk-based approach. So, the sponsor and or investigator institution should implement risk-based quality checks or review processes to ensure that the TMF is being maintained up to date and that all essential documents are appropriately filed in the TMF. So this is taken from the guideline on the content management and archiving of the clinical trial master file, right? Essentially, this is telling us that we need to be taking risk-based quality checks. If we are QCing every single document that comes into the system and doing edit checks every single day, it's going to take a lot of time. And I think inherently, we've already started taking risk-based approaches, but it might not be as defined as perhaps a risk scoring technique, right? And so this is going to really allow us to focus on where we need to do additional QC, what part of the system, what process zone, or what site. And there should be many factors, as you can see on screen here, that go into deciding a risk score. It could be a single artifact or process zone, an investigator, the anomaly rate, so events that have happened or safety cases at a certain site could impact your risk score. If there are significant timeliness delays, that would impact your risk score. So we really need to look at exactly what's happening in all of these different criteria to be able to determine where we should be spending most of our time. Right? And I think by doing all of these different things, we're really going to be increasing the quality de facto. So in conclusion, to get a more holistic view of our clinical trial, we really need to be looking at integrating our operational systems. We also need to start viewing documents as processes and not in standalone repositories, because that really doesn't allow us to understand the full story. We looked at quality and how it should not only exist at the document level, but also at the data and the process level. Does my TMF make sense as a whole? And, to finish off, all of our systems hold critical information that can be used to increase quality as a whole. So we need to look at our technology ecosystem as one and not as multiple disparate decentralized systems. Thank you.
Good job, Kat. That was pretty interesting.
Amazing. Thank you both so much for such a great presentation. I think you were able to talk about a very technical subject in a way that made it for people like myself to understand. So thank you so much for that. There are a few questions that came in. Paul, you mentioned earlier on in the presentation around opportunities for artificial intelligence. Could you maybe talk about maybe some of those examples of how artificial intelligence could potentially be used in this area?
Yeah. I mean, I think right now what we're seeing is a lot of companies are starting to talk about AI, but it's primarily within the context of indexing. So like identifying documents, extracting metadata, and indexing those documents. So trying to replace that very manual process that we do today. And that kind of approach exists in many other industries and has existed for quite a long time. And so I think that that's kind of the obvious starting point. And it's also really important to have that for two reasons. One, if we can extract metadata using AI, we can extract a lot more of it. Today, we're actually quite poor when it comes to metadata because it's too labor intensive to enter it by hand. So we can get a much richer information base, which will allow us then to extract that information and tell a better story. It also would allow us to change a little bit the focus of the TMF management teams from indexing to actually focusing on quality and actually managing the processes within the study, and obviously with the study teams, and making sure that the processes that we're showing in the system with all of the artifacts are complete and they make sense. So I think that that's really, really important. The other thing that I started to touch on was the ability to use AI to analyze the data and extract the context. I think context is something that's super important when it comes to telling a story, and it's something that we have a hard time with today, and especially given that a lot of the information that we're using or storing is very unstructured. It's in documents, it's in emails, and I think that there are tools out there, and there are algorithms and techniques out there that would allow us to really start to mine the information and connect it together. And that, I think, is extremely powerful, because I'm pretty sure that everybody on this session has issues with emails.
Yeah.
It's a big problem, and everybody's been scratching their heads forever trying to work out how can we do this better. So I think that definitely is really a key candidate for machine learning. But I also think that machine learning will enable us to start to open up the value of our TMF, because if you think about the TMF, it's really a gold mine of information. There's so much information that could be really, really valuable if it was put in context. And so I think that that's where AI will really help us. It can also be used for other things like quality. We can verify the quality of documents. Alcoa could be automated. Yeah. And I just think that there's definitely a lot of applications. And then the final thing is analyzing what's actually happening in terms of processes in a whole series of studies, and then using that to improve our process model, because it's based on historical information. That, I think, is also key. So it's a really exciting time in the industry, because we're starting to embrace this technology. And here at Montreal, we're also working on that. We've got a team of people who are starting to look at AI and working on use cases that we want to implement in our system. So very exciting stuff.
Yeah, I think also what's kind of interesting, as you were talking, Paul, it was sort of reminding me of how something that we all use in our personal lives has changed over the years, like a Google search, right? So if you remember doing a Google search maybe 10 years ago, you had to be very, very specific to what you were looking for, right? But now if I search for Indian restaurant, because I'm looking for Indian food, it will automatically know that I'm looking in my local area for that restaurant, right? And you can see those sorts of principles being applied in the TMF world, right? So if we're potentially uploading a document, rather than having to try and locate where that document should go, maybe it could suggest document metadata based on what it knows about me and my role in the study. Am I a monitor of a certain site? And so is it going to suggest certain information or infer certain information? So I think there's just, like you said, there's a lot of opportunity for us to use modern technology to help digitize some of these manual processes today. And I think the key thing that you mentioned, Paul, that I'll take away and hope everybody takes away, is that we can have everybody focus more on quality, right? And having that culture of quality. Today, we're so focused on filing, we're so focused on timeliness, but really quality is such an important factor.
Right, and that's the next big thing, right? Because as you probably heard yesterday, and there was a panel discussion on ICH E6R3, and there's also E8. it's all about quality by design and building quality into your processes, building quality into your systems. And that I think a lot of people are starting to kind of wake up to. We need to build in quality, and we need to have much better risk management techniques. And I think that's also where, Kat was talking about, the ultimate quality metric, the risk score. For us to be able to use that, because it's a great technique for being able to do sort of focused QC rather than 100% blanket QC, which ultimately doesn't give you quality. You can actually pull out all of the information that you need to be able to calculate those risk scores, things that we could never do before. And then also using AI to identify sort of outliers or things that we're not necessarily looking for, but AI is able to detect them for us. So no, it's a whole new world that's coming our way. It's going to take a little time, and we need standardization to do it. But it's definitely the train has left the station, so that's great.
Yeah.
And you talked about yesterday in your presentation, for anybody that attended your presentation yesterday on standardization, you talked about areas that are ripe for standardization. You talked about metadata, right? I guess in this instance, metadata and standardization of metadata helps us get closer to using AI in a more holistic way, right?
Yeah, because AI, it needs to be trained and it needs to understand what you're giving it. And I think especially if Kat was talking about the fact that we have all of these different systems that are all TMF relevant, and we need to connect them together to be able to tell the full story. We need standards for that. We have to have standards. If we don't have standards, it's never really going to happen. And AI, to a certain extent, is the same thing. We need to leverage the standards so that the AI understands the messaging that it's receiving from those other systems.
Yeah.
Perfect. I know that we're at the end of time. There were a few other questions, so what we'll do is we'll take a look at those offline. Thank you for everybody that threw in some kind words to Paul and Catherine around your presentation. So you'll be happy to hear, Catherine and Paul, that was well received by the audience.
Thank you.
We have a session coming up in about 15 minutes. We're going to be focusing on integration in a little bit more detail, but we're going to be focusing on something slightly different. The session is going to be integration or data lake, how technology has evolved to meet the clinical trials of today. So I think this is such a perfect follow-on from this presentation. It's going to talk about some of the real-world examples at a sponsor organization on how these different things can be implemented. So with that, I will thank everybody for their time. Again, we have about 12 minutes to jump over to the networking lounge. Catherine, Paul, myself will be there for a brief discussion. Hopefully you'll join us in the lounge for a chat before the next presentation.
Thanks,
Great.
everyone.
Thank you, Oliver. Thank you, Kat. Great presentation.
Thank you all.
Bye-bye. Thank you.